We're talking to Dr. EWestman from Duke University, and of course we're talking about some of the problems of lifestyles and lifestyle changes that might enhance an individual's health. And of course, Doctor, let us allow you to continue our discussion here.
Great. Well, this has been very, very informative for me too. Thank you. I would like to switch gears a little bit, and while I manage weight, and the bariatric physicians are weight management physicians, weight change should be the first thing you think about with diabetes. And so I'd like to spend this last segment on type 2 diabetes and obesity, what you could do at home, you know, tips for people whose doctors aren't giving them the right information and all that. But I'd like to point out that what we do in our clinic is nothing new. In fact, I understand you're a bit of a history buff yourself, and during my first study that I did with the low carbohydrate diets, a patient of mine brought in this book. It's a book from 1923 from the Appleton and Company, the late Sir William Osler. You recall William Osler as an internist, wasn't internist, kind of the father of internal medicine. Well, this patient brought it in, knew I might be interested, and I was doing this study that nobody really thought very highly of at the time. It was a low-carb diet. But you'll see here for the type 2 diabetic, now this is before insulin was available. 1921 insulin was discovered, and then it was put into practice pretty quickly, but this is before insulin. And the quantity of food required by a severe diabetic, weighing 60 kilograms, so about 130 pounds, was 10 grams of carbohydrate per day. Now, I looked at this in my clinic when the study was going on, and I thought, well, I'm telling people to eat these foods. I'm telling them to eat asparagus, Brussels sprouts, cauliflower, broccoli. And here, that's what Osler said people should do. So
the man responsible for internal medicine.
For internal medicine, that's right. Well, so they didn't have insulin available at the time. They didn't have these pills and all that. So all we're doing is we're giving people the option of using the knowledge that was gained before all these medicines were available. So if you trace the teaching over time, this is from 1952, the diabetic ABC, you'll see that there's a little bit of loosening, although protein and fats are at the top, animal food and fats, butter is fine, cream, olive oil, you know, is still hot today. And you can have unlimited amount of low carbohydrate, starchy vegetables, but you limit potato, the size of a hen's egg should be the size of the potato, so the starchy vegetables are reduced. But now in 1950, doctors were able to use insulin, and so they allowed the diet to become less strict and use insulin. The problem today is that diabetes, type 2 diabetes with obesity is still a very bad disease. So all it takes is one family member who goes on to dialysis, has blindness, has amputations, for some other family member to know that this is something you don't want. And so the lifestyle program that we have just takes people back to what was known before all of the drugs and all the other things that are available. So things that you should think about at home are no sweetened beverages, please. No sugar in the beverage. I can get my diabetics to get a little bit better just by having them change from sweet tea to unsweetened tea, or using a sweetener like Splenda or aspartame, something like that. Other things to watch out for are those fries. So if you make that fast food, you supersize it or whatever it's called in whatever restaurant, those fries make your blood sugar go up. So remember that potato is limited, and even
the size of a hen's egg.
Or even before that, you didn't have any potato at all back in 1923. So what's really exciting is that by making these changes, you can influence the diabetes. You can make it better, and also you're losing weight. So the diet and then the weight are both a factor for type 2 diabetes when you have obesity. And so you've got to lose weight. You've got to do everything you can. And if your doctor's not responding, I can suggest the American Society of Bariatric Physicians, because they'll respond. We train them in this approach. They use appetite suppressants, that sort of thing. And that's beyond Duke. That's all over the country. It's a great organization. We call it the ASBP for short. But you have to control